Hello students, the topic we'll be seeing today in oral histology is periodontal ligament fibers and age changes in the periodontal ligament fibers, PDL. The contents under this topic will be periodontal ligament, PDL, development of PDL, cells of PDL, collagen fibers of PDL, axis of rotation in PDL, fibers of PDL, and age changes of PDL. Periodontium consists of the gingiva, cementum, periodontal ligament fibers, and the alveolar bone. Gingiva this is the tooth. White colored area is the enamel. Surrounding the enamel, this yellow color region is the dentin. Pulp is present in the middle. And surrounding the tooth structure is the periodontium. It is comprised of gingiva, periodontal ligaments, cementum, which is present between the dentin and the alveolar bone, and here is the alveolar bone. The periodontium has the shape of an hourglass. Important one word. The PDL is narrowest in the mid-level of the root, especially on the mesial surface, and it is thickest at the apex of the root. One word to note. Thickness of PDL is 0.15 to 0.38 millimeters. The development of periodontal ligament begins with root formation prior to the eruption of tooth. Formation of PDL occurs after the cells of Hertwig's epithelial root sheath has separated. Principal fibers of PDL development in conjugation with the eruption of teeth. That is, the principal fibers of PDL develop in conjugation with tooth eruption. Cells of the PDL are synthetic cells, osteoblasts and fibroblasts. The fibroblasts are the predominant cells of the PDL. They help in synthesis and degradation of collagen. Second is the resorptive cells of PDL. They resorb the periodontal ligament components. They are the osteoclast, fibroclast, and the cementoclast. An important point to note is that PGE2, prostaglandin E2, produced by macrophages and fibroblasts of the PDL, contribute to bone loss during periodontitis. Important one word to note. Bone loss during periodontitis is contributed by PGE2, which is produced by macrophages and fibroblasts within the PDL itself. Collagen fibers of the PDL. Type 1 and type 3 collagen fibers are present in the periodontal ligament. The periodontal ligament fibers have the highest turnover rate. Rapid turnover rate of collagen in periodontal ligament is more towards the bone side. Important one word to note. Collagen degradation in PDL is caused by the following. Please make a note. Aspartate transaminase, alkaline phosphatase, beta glucuronidase, matrix metalloproteins. Axis of rotation in PDL. Periodontal ligament is thinnest at its axis of rotation. Axis of rotation for a single rooted tooth is at the junction of the middle and the apical third. If you can see, imagine the tooth structure. Between the middle and the apical third is the axis of rotation for single rooted teeth. Axis of rotation for multi-rooted tooth is between the roots, is in the bone between the roots. Fibers of periodontal ligament are principal fibers and elastic fibers. The elastic fibers are only two types, oxytalin and enamel. But the principal fibers are of 6 types. They are made up of type 1 collagen. Number 1, transeptal fibers. 2, alveolar crystal fibers. 3, oblique fibers. 4, horizontal fibers. 5, apical fibers. And 6, interradicular fibers. Principal fibers of periodontal ligament. This is a very important topic both in oral histology and periodontia. So please pay attention, students. Transeptal fibers, they run between the adjoining teeth and give interproximal support, also known as interdental ligament. constructed even after the destruction of alveolar bone. They can be reconstructed. This is an important point to note. Alveolar crystal fibers, they run from the cementum in an apical direction towards the alveolar crest. Their function is to resist extrusion and lateral movements. Students, please pay attention to the feature of each principal fiber of PDL. Everything here, every point given here is a one word. Third one, oblique fibers. They run from the cementum to the alveolar bone in coronal direction. They are the highest in number. They suspend the tooth and resist vertical masticatory forces. Horizontal fibers. They extend at right angles from the cementum to the alveolar bone. Apical fibers. They arise from the root ends. They are absent in incompletely formed roots and they resist tooth rotation. And the last one, interradicular fibers. They fan out from the cementum to the tooth in the furcation area of multi-rooted tooth. Principal fibers of PDL are given in this image. Apical fibers are here, oblique fibers, horizontal fibers, alveolar crystal fibers. Age changes in PDL. So as the tooth ages, increasing factors and decreasing factors with age are listed here. This is also a very, very important one word. So please pay attention to what the increasing factors are and what the decreasing factors are. Age changes in PDL. As the periodontal ligament ages, the following factors increase. Elastic fibers, epithelial permeability, width of attached gingiva, collagen content, cemental width, and surface irregularity. As the periodontal ligament ages, the following factors decrease. They are fibroblasts, collagen fibers, keratinization, thickness of periodontal ligament, rate of collagen synthesis, number of fibroblasts, production of organic matrix, and epithelial cell rest. We are ending this class here, moving on to onwards. Extrusion and lateral movements is resisted by dash. The answer is alveolar crystal fibers. Alveolar crystal fibers of the periodontal ligament resist extrusion and lateral movements. Second question. Intrusion and vertical movements is resisted by dash. The answer is oblique fibers of periodontal ligament. Third question. Fibers that are destroyed first in periodontitis are dash. The answer is free gingival fibers. This was a very often repeated MCQ, students. Fibers that are first destroyed in periodontitis are free gingival fibers. Question number 4. Fibers that resist rotation are dash. Answer is apical fibers. Question number 5. PDL fibers are activated when resisting dash forces. Answer is vertical forces. Question number 6. Fibers of the lamina propria that help to bind the free gingiva to the tooth is dash. Answer is circular fibers. Question 7. Collagen fibers have a transverse striation with a characteristic periodicity of dash. Answer 64 nanometers. That's all for this class, students. Thank you.